Hi, I'm Dr. Dean, and this is a short informational video on chalazions. So chalazion is a bit of a mouthful, but it's a very common, extremely common condition we see really often in ophthalmology. And essentially it's a blocked meibomian gland that may become infected or not infected, or have a collection of oil and material in the eyelid. So let me just show you what meibomian glands are. Meibomian glands produce oil, so they're the oil producing glands, and oil is really important for your tear film. So your tear film is this film of fluid of lubrication over the surface of your eye, and meibomian glands produce that oil. So you can see these meibomian glands run vertically in the upper lid and the lower lid, and what can happen is these glands can become blocked. If one of these glands becomes blocked and it keeps producing oil and the oil can't get out, you start to get a swelling in the eyelid, and that's what we call a chalazion. So here's just another anatomical diagram. This is just showing you where the glands are, and if I look in cross section over here, this is the skin on the front of the lid, here's the eyelashes, and you can see here's the meibomian gland, and this is where the meibomian gland opens up, and that's where oil is released. So if you get a blockage here, then if you get a blockage over here, then what can happen is this can swell up and can become large, and you can get what we call a chalazion. So what does that look like clinically? Here's another diagram. Again, in the eyelid itself, you can see you get the swelling and a chalazion forms. The eyelid becomes red and you get the swelling on the eyelid, and that looks like this. So this is a typical chalazion, very red, swollen, and if you palpate or you feel over the lid, you can normally feel quite an obvious bump there. So how are chalazions treated? Some of them resolve spontaneously. So quite often patients will say they had one and it disappears, they had another one and it disappears, and at some point one developed and they couldn't get rid of it, and they come in to have it looked at. In those scenarios, normally we need to drain them. Normally it's a relatively simple, quick procedure to drain the gland, but the other way if one is trying to avoid drainage, what one can do is with warm compresses and lid massage, which I've done another video on. So if you're wanting more information on how to do warm compress and lid massage, you can have a look at that video. You can inject them with cortisone as well. A cortisone injection into the chalazion itself can also result in it resolving, but majority of the time we recommend warm compresses and lid massage initially. If it's non-resolving, then we normally look to do a drainage, which requires a very small surgical procedure where we inject the lid with local anesthetic and drain that gland here in the rooms. If it's something that's recurrent and you keep getting them, there are other things that sometimes we need to do, but normally warm compresses and eyelid massage is really the main therapy to try and prevent them. And if people are very aware and they feel their lids often and they feel one starting, to start with warm compresses, and they can often prevent that becoming a large chalazion that requires drainage. So that's basically what a chalazion is, the anatomy of it, and the basic idea behind how we manage it. I hope it was helpful, but if you need more information, please feel free to contact us.